The Legacy Circle is a very special group of donors that support the Hancock Health Foundation's commitment to having a healthier community. These are people who have donated at least $10,000 over a period of time.
We've enjoyed being part of the Legacy Circle just because it provides a great vehicle for us to be able to support those who have challenging situations and circumstances, and that's always been very important to us as well.
My desire is to help serve this community as a business owner, as an attorney, but it's also a desire to help serve financially. And one of the best ways that I've learned that I can help this community is through the Hancock Health Foundation.
Donors have a big impact in our community. They help support the tradition of excellence at Hancock Health, make sure we have access to the best health care available, and ultimately help ensure that we have a healthy community. Funds from the foundation help to keep our health care local and independent, and also pay for services that are not fully reimbursed by insurance or by the patients themselves.
For them to go out and decide to offer services that don't provide a profit to them is an extremely difficult and courageous decision by the leadership of the hospital. And if I can help support that financially and provide those services that wouldn't otherwise be provided, then I'm happy to do it.
The first project that I worked on was a new emergency department and a cardiac intensive care unit, as well as support for the James T. Anderson Women's Center for Health and Wellness. After that, we worked on a campaign for hospice care. After that, we worked on a campaign to build our beautiful cancer center. And even more recently, we worked on our mental health and substance use treatment campaign.
Part of my practice was helping people navigate end of life. So when we had an opportunity to support the inpatient hospice unit, that really resonated with things that we felt was very important. The James T. Anderson Center for Women's Health was one of those things that had particular significance for me, and Dr. Anderson was a highly respected senior physician, and so to be able to support something that he and really his family brought to the hospital was really a privilege for me.
We now have funding through an endowment that allows the hospital to cover the cost of services such as mammograms for women that wouldn't otherwise be able to pay for them themselves or would cause the hospital to have to provide those at a loss. We're able to provide income to pay for these services for the Women's Center and the Women Helping Women program. We've formed an endowment to raise funds for what we all know, especially since COVID, is one of the most important components of our well-being, our mental health.
Having a place that is welcoming and warm, and most importantly for Hancock Health is kind, is really invaluable.
You just hear of people that don't have health care or don't have the means to go to the hospital or to a physician, and they don't do it because they're afraid of the cost. So if they find out there are programs that are funded that they don't have to pay for, that also helps a lot of those people. And then the other thing is getting the word out that those programs exist for people.
Hancock Health is in a unique and challenging position right now. We have shrinking reimbursements, we have a call for more and more services, and we are operating on thin margins.
The need for these services is only going to be greater and greater, and therefore the funding for these services is going to be greater and greater because our community is rapidly growing. Hancock County is the fastest growing county in the state of Indiana and one of the fastest growing counties in the country. And through the Legacy Circle and the Hancock Health Foundation, we can help provide those services that wouldn't be available otherwise.
As a member of the medical staff for over 30 years, and as a member of executive leadership team for 20 plus years, I really want to thank all members of Legacy Circle for their support in the past, present, and even in the future.
Without their commitment, without their support, without the volunteer hours, without the money and the energy and the resources, the hospital and the foundation wouldn't be where it is today, and we wouldn't have the growth that we've had over the last 20 years. So as a foundation board member and also as a member of the Legacy Circle, I would like to say thank you to all of the people, hundreds of them, who have made the foundation what it is through their commitment with their time and money.
You can learn more about the Hancock Health Foundation by checking out our website, by talking to any Legacy Circle member, or by calling Allison Smith, our Executive Director at the Hancock Health Foundation office.